This animation uses a typical scenario to show you how a musculoskeletal disorder can occur when handling people in a health, aged care, rehabilitation or disability support services setting, and what you can do to prevent them from happening. A support worker was transferring a person with limited mobility from their bed to a wheelchair. During the transfer, the retaining pin on the mechanical lifter malfunctioned, dropping the sling and the person. The worker tried to catch the person, however they landed in an awkward position and suffered a lower back injury, which is a type of musculoskeletal disorder also known as an MSD. The person receiving care also suffered bruising to their hips. Before the incident, the worker had previously raised a few issues with their manager. They were not familiar with the mechanical lifter, including how to inspect and maintain it safely. They felt they needed more support and information on how to transfer people safely. These concerns were not addressed by the manager. There were 4 issues that led to this incident, including improper equipment installation. The retaining pin which connects the lifter arm to the actuator was installed in an incorrect position, resulting in damage over time. Lack of management support. The manager did not give training or support to the worker on how to inspect and maintain the mechanical lifter. Lack of inspection and maintenance. The incorrect position of the retaining pin was not identified due to the lack of maintenance and pre-start inspection procedures. Individual factors. The person being transferred experienced body tremors due to a neurological disorder. These tremors exacerbated the damage to the retaining pin and led to the actuator collapsing. These 4 issues together led to the incident occurring. There were also other contributing factors. The employer failed to identify and manage MSD risks relating to people handling in consultation with workers. Put in place a process for inspecting and maintaining equipment. Consider the individual factors of the person receiving care and how it impacts on the task and equipment. Give information, training and instruction to workers on how to set up the lifting equipment. Give support when workers raised work health and safety issues. For employers in healthcare and social assistance who have workers responsible for people handling, such as in-home carers, support workers, aged carers, disability carers, and hospital staff, it is vital that you manage the risks to health and safety relating to people handling tasks. This may involve initial and ongoing risk assessments, such as a manual handling assessment of the person's mobility. Maintain equipment and put inspection routines in place. Consider the individual factors, including medical conditions of the person receiving care and how this may impact on the task or equipment. Consult with workers about factors that may lead to MSDs. For example, discuss how many workers are needed to do the task safely. Give information, training and instruction to workers. Address work health and safety issues raised by workers. The impact of MSDs on workers and businesses is significant. Personal impacts on workers include poor mental health, relationship strains, financial burden, and an overall decreased quality of life. Impacts on businesses include decreased staff morale and work culture, reduced productivity from time away from work, financial loss, including high workers' compensation claims costs, disruption to work, such as absenteeism, staff replacements, and additional training. MSDs are preventable. Simple changes can make a difference. Proactively addressing MSDs is part of your work health and safety duties. So don't wait for an incident to occur before you act. To learn more about musculoskeletal disorders and your legal obligations, visit our website or call 13 1050.